Hello, everyone, to today's COVID-19 President's Forum, All-Campus Forum, Political and Community Leaders. Today is Monday, April 6th, 2020. Thank you very much for joining in. Just a couple of housekeeping notes. Please keep yourself muted at all times and your video off to ensure that we're paying attention to our panelists. Also, if you see yourself have any questions or anything, please jot them down in the chat feature down below, and the panelists or one of our other individuals will answer to them. If you have any other questions towards the end of the time, we will have our panelists respond back. Without any further ado, let's bring it over to our President, President Sonia Christian.
Well, good afternoon and welcome everyone. Happy to have our community and political leaders with us at Bakersfield College as we go online. I always start my remarks with the dashboard from Johns Hopkins. And as you can see on the very next slide, that the numbers are rising worldwide. They're rising in the United States and in California, with Kern County having registered 2 deaths. Moving on to the next slide and looking more closely at Kern County, I was surprised, for example, to note that approximately 52% of the confirmed cases here in Kern County are between the ages of 18 and 49. So you can see with the evolving understanding of this novel coronavirus, COVID-19, that even those who are vulnerable to the illness is changing as the clinical trials are expanding. Moving to the next slide and looking at the growth trajectory over the last 7 days, you will see that the percentage growth in the United States is well over 100%. California is at 108, and Kern County at 214.5%. Moving to the next slide, I want to bring a personal note and a face to this epidemic. Susie Garcia, 52, passed away in the Delano Regional Medical Center. Her son, Hector Garcia, graduated as a renegade in 2016. Yes, my dear friends and colleagues, it's close to home. Moving to the next slide, this is a dashboard that Leslie discovered that captures sort of the data from cell phones of individuals who are driving in their vehicles. And in this particular dashboard, it says that Kern could do a better job in staying at home and sheltering in place. Moving to the next slide and looking at the weeks ahead, I was following the presentation from the White House yesterday. I'm sure you were as well. Also following Dr. Tony Fauci very closely. And basically what they're telling us is to really watch out for the next few weeks as the United States peaks in this epidemic. Moving to the next slide. This is another dashboard that I bring to you every time I do a virtual forum, every time I send a Renegade Roundup. And Murray at IHME gives us an updated model with the data that was collected from last week. You will see that in the updated model of the IHME compared to last week's, moving to the next slide, that the total number of deaths, so I think if we can move, yes, this particular slide, that the deaths per day in the United States when it peaks, we're supposed to peak on April 16th, is 3,130. So I went back and compared it to my notes from last week, and last week it was 2,214 in the model. It's just a model, but our behaviors can, and other data as it feeds in, it then goes ahead and it updates the model. So things are not looking very good on the national front. Moving on to the next series of slides. Again, I'm sorry, the U.S. total deaths here is at 81,766. And when I went back and I looked at the data that I shared with you last week, it was 83,000. So moving to the total number of deaths here in the previous slide, Shannon, you will see that the total number has actually gone down, which shows that some states in the nation that the model predicted was far worse than what is really happening. So now let's fast forward 2 slides to the situation here in California. And it's difficult to say good news and deaths in the same sentence. But what I would like to share with you in the next slide for California is that the deaths per day has decreased to 70 when it reaches the peak. You will notice that the peak has also changed. Last week on March 31st, the peak was on April 26th. And now the IHME model has changed it to April 13th. And the projection shows 70 deaths per day when we peak on April 17th, which is much less than the 122 that we had before. And the range of 9 deaths per day to 293, and that's a huge range, you can see is also different. So there's some phenomenon that is happening in California that seems to be working in the model compared to what we had a week before. Moving to the next slide. So the total deaths predicted by August 4th is 1,783. And in this slide that Dylan prepared for me, I went ahead and added some words because I went back and compared to last week, and the number that Murray had put out at IHME was over 5,000. And now that has decreased to 1,783 in the state of California. So moving on to my final set of slides here, Shannon, my message to you, fellow faculty, staff, and student renegades: stay at home, stay at home, stay at home. When you go for a walk, maintain your distance. Stay healthy, sleep, get a lot of rest. And now we were starting to signal that if you're going and you're interacting with people, like in the grocery store, or you're going to the pharmacy, then potentially you should think about doing a face cover, which is a non-medical face cover. This was a debate being put out by CDC a few days ago, but at BC we started signaling that we should probably do it if we needed to go out. So moving to the next slide, we have been using the phrase, and this is mostly for our panelists, that BC has been ahead of the curve. And as our jazz music faculty described it, we've been letting the times guide our creativity. Moving to the next slide. Here is our timeline that I'd asked Leslie to update with some of the newer pieces of work that we are doing so that we're keeping track of this historic journey that we as fellow renegades have been going through since January. We started tracking this in January when the count worldwide was nearly over 9,000. But because of the smart, talented scientists we have in our faculty and those in our clinic, our health clinic, we started tracking and closely watching. So I'm not going to go into the details here. I do want to tell you that we have a back to college program that we have put together for those who are being laid off given this significant recession that we're going into with a stay-at-home executive order. Moving on to the next slide, you will see that we're really proud of our students. They're out there at the front line helping nurses and doctors. And this was featured a lot in many of the newspapers. And I'm just thankful to celebrate our students, our nursing faculty, and our Associate Dean, Carla Gard. Moving to the next slide. You know about the unemployment. Can't wait to hear from our speakers about their take on what they're predicting will happen in the future. Moving to the next slide. Here is BC's Back to College program. And again, you know, Richard Chapman, Vince Fong, Romeo Agbala, Jean Fuller, let's get this message out to individuals. We had a surge of individuals enrolling. We can get folks back in because guess what? Financial aid will cover them going back to school if they can't count on another paycheck. Going back to the next slide. Now what? I've been following this particular story written by Ed Young, and I haven't updated in all of my readings. I think his piece on March 25th has been guiding my thinking, where he talks about the next few months is going to be looking at manufacturing, equipment for the hospital, masks. There's going to be testing that's going to be done in large scale so we can really get a sense of the count. In the next year or two, there's going to be a vaccine that comes out, and there could potentially be a recurrence when we go into the winter months. And then he talks about the aftermath of COVID-19. But at Bakersfield College, your executive leadership team is looking at this and providing more opportunities. My dear students, you're going to see our semesters being flexed. You're going to be seeing more options to get more classes out of the way rather than the traditional approach. So you have innovation flourishing at the home of the Renegades. It's all about more opportunity, more flexibility, and more support for you. As we move into introducing our panelists, this is our next, tomorrow's presenters, but let's go to our panelists for today, Shannon. So fortunate to have Assemblymember Vince Fong, who's very close to Bakersfield College. He's in text message contact with me regularly and with others, taking care of our community in Sacramento. We have the fabulous Senator Emeritus Jean Fuller, whom everyone loves, who fought for us in Sacramento, a superintendent, and now is helping the most vulnerable of our population in Shafter, in McFarland, in Delano. We have Richard Chapman, who's going to be talking about the economy and how he sees it. Again, a friend of BC and a friend of our community, always on the cutting edge of innovation. And last but not least, today, wearing his hat as the Executive Director of Current Citizens for Sustainable Government, also one of our favorite trustees. He's going to be bringing the lens of sustainability and innovation as we tackle education in the COVID-19 world. Assemblymember Vince Fong.